Good afternoon, everyone. This is Jeff Gelblum, your friendly neurologist from Aventura, Florida, and also Midtown Miami, who's here today to discuss with you long-haul side effects, long-haul events that occur within the presence of coronavirus. Now, a lot of what we have been discussing over the past few months on these Facebook Live programs has really involved how to avoid catching COVID, applications of the new vaccine. So basically, it's been on a very prophylactic, very preventative basis. But for those of us who have caught COVID, fortunately, I myself have not yet, but I will be in line to get the COVID vaccine when it's available to us healthcare providers. For those of us on today's Facebook Live and who are participating in this conference today, for those of us who have had COVID, there are some certain things that I want you to be aware of, because we think of COVID as primarily a cough, a fever, a sore throat, primarily upper respiratory with some pulmonary involvement. The issue is, if you have COVID, be very careful of your lungs, sleep prone, take an antibiotic if you start to develop fevers with a productive cough. Zinc, of course, is part of the program, as well as good hydration and good nutrition. But many of us have had COVID and are now experiencing what we call long-haul sequelae, long-haul side effects. So my goal today is to take us through some of the neurological long-haul effects. Now, I'm a neurologist. Obviously, I'm not going to speak about long-term rheumatoid or long-term pulmonary or long-term cardiovascular issues, but those things do exist. And for that, I'm going to defer to my cardiology colleagues and my pulmonary colleagues. But in the neurology practice, we are seeing side effects, long-haul sequelae from COVID, and I want to bring that to your attention so that you understand that there is very good treatment for these symptomatic sequelae that are an outcome of the COVID attack. So let's first talk about the coronavirus. What does it do? Well, we know from the onset, COVID-19 is a neurovirus, meaning it falls within the corona class, but we do see that the first symptom of the disorder is loss of smell and loss of taste. So what does that tell me? Well, that tells me that the virus is latching in to the nervous system by way of the first cranial nerve, which is the olfactory nerve, and it's also coming in through the 7th and 9th cranial nerves, which involve taste along the anterior and posterior aspects of the tongue. So make no mistake, COVID is a neurological attack in many, many respects. And with that being said, the first clinical symptom of COVID is loss of taste and loss of sense of smell. So anybody who experiences that needs to immediately be tested for COVID, because that's the likelihood. At this time, with the pandemic raging, if you suddenly lose your sense of taste or your sense of smell, you can really assume that you may have COVID. In fact, a patient of mine who I've been treating for another disorder called me recently and said, you know, I was out with my fiance. He took me for a very expensive plate of stone crab. I didn't really taste them. I didn't want to say anything because they were expensive and I didn't want to make him feel bad. And then the next day, he got me a bottle of perfume. And then she says to me, well, I didn't taste the stone crab last night and I can't really appreciate this expensive bottle of perfume. And I said, hello, you need to get tested immediately for coronavirus. And in fact, the test was positive. So loss of sense of smell, loss of sense of taste, those are your first things that should send the alarm that you are possibly infected with COVID. So what's the natural sequence of the COVID attack? All right, so you have these experiences on day one. We do believe that the infectious phase probably endures for about 10 days. So if you lose your sense of taste or smell today, get yourself tested with COVID. Chances are you are going to test positive. It means you've probably been infected for at least 2 to 3 days preceding. And we believe that at this point, it's important to quarantine for at least 10 days once you have the positive diagnosis, because it's that 10-day time frame by which you become extremely infectious. And we know that COVID is airborne, so just being in the same room as someone with COVID may be sufficient to get you infected. Historically, and when I say historically, I mean a few months ago, we thought that that person actually had to cough or sneeze in order to transmit some droplets, but we now believe that the virus can remain airborne and it doesn't necessarily have to travel on a droplet in order to infect another person. So 10 days is the infectious time frame by which COVID people need to isolate, and that's why it's a recommendation from the CDC that if you do test positive, you stay in isolation for 10 days. And then after the 10 days, if you're feeling good, you can go back to work, assuming that you have no fever and that the symptoms have resolved. I want to remind you that it's not necessary after you've had that positive COVID test. And by positive COVID test, I mean the PCR test, the nasal test. The rapid saliva tests are not thought to be as sensitive to a COVID attack. So really the gold standard to this time remains the nasal PCR test. That's where the swab goes up the nose. It may not be as quick an answer as you'll get with a saliva test, but it's going to be your most accurate result. So with that being said, isolation for 10 days, and then assuming that you're not having a fever, assuming that your symptoms have resolved, assuming that you don't have to take Tylenol to keep your fever down, at that point you can go back to work, go back to visiting your family, etc. So now let's talk about those people who continue to feel bad after the 10-day infectious phase. And those people who continue to feel bad, we call those the long haulers. And we neurologists, I've got my esteemed colleague, Dr. Leonard Cohen, who's also watching right now. Hi, Len. We are seeing a lot of long-haul coronavirus-related illnesses in the office. In fact, each and every day, I'm seeing something that can be attributable to the coronavirus. So many of my patients who've had coronavirus, no longer infectious, and a few weeks after the fact are still complaining of headache, fatigue. Sometimes they can experience vertigo, which is room spinning sensation. Typically, the loss of sense of taste and smell, that corrects rather rapidly in my experience, but there are some long-term sequelae that do tend to persist. One of the serious sequelae that I've seen is the stress of the coronavirus can often predispose to comorbid or to simultaneous attacks. In fact, I have a patient who was diagnosed with positive coronavirus, obviously not feeling good from that illness. She was symptomatic. A lot of people are not symptomatic, but she was symptomatic, middle-aged gal, and she developed shingles simultaneous to the coronavirus infection. Now you can say, wow, that's really a stroke of bad luck. What happens is the coronavirus, as you can imagine, is extremely taxing to the immune system. So if your immune system is heavily taxed trying to fight the coronavirus, it's going to let down its guard with regard to surveilling and to maintaining good immune competence against other types of infections that may be latent in your body. So therefore, it's important that all of us who are listening today, who anticipate or are concerned about potentially catching COVID, you need to make sure that your vaccinations are up to date. And I'm not just talking about an influenza vaccine. I'm also talking about a shingles vaccine. So if you are over age 50, you are now within the demographic that is approved to get the shingles vaccine. So I highly recommend a shingles vaccine, not only in anticipation of perhaps getting COVID and a further tax on the immune system, but just to make sure that you don't get shingles down the road. So it's very important, because of the tax on the immune system that is conferred by the coronavirus, that you make sure that all your vaccinations are up to date. So I can tell you, definitively today, if you're over the age of 50 and you have not had coronavirus or are not in the midst of having coronavirus, please make sure that you get your shingles vaccine. Very, very important. The tax of the immune system by virtue of the coronavirus infection can really put the guard down and make you susceptible to shingles. And shingles is an awful condition. It's an extremely painful disorder. Everybody knows someone who has had shingles. So under periods of stress or immune decline, shingles can rear its ugly head and really make your life a living hell. So that is why I do recommend shingles vaccination for all folks over age 50. And clearly within the midst of a raging COVID pandemic, it's important to make sure that your vaccination status is up to date. Over age 50, definitely get the shingles vaccine. Why? Because a shingles attack can be one of the sequelae that we see in folks who have now come out of the coronavirus attack, but then suddenly fall into a shingles attack. So we don't want that to happen, so keep your vaccination status up to date. Another serious side effect, long haul sequelae that we see with coronavirus can be vascular headaches. People who were not headachy before can start to develop a migraine-like disorder, a vascular headache syndrome. What does that mean? It means throbbing headaches, stabbing headaches, headaches typically behind the eye. Different than a tension headache and different than a headache that you would get if you're just fatigued. But a true vascular headache, a migraine attack. And what I'm trying to emphasize here is, unfortunately, there is no cure at this point for COVID-19. We don't have a drug that we can inject that will magically destroy the COVID virus. We have vaccines, 2 vaccines that are now out. In fact, if you saw in today's news, the first people in the UK, in Britain, have just been vaccinated today. I think it was a 98-year-old grandmother and then another old guy by the name of William Shakespeare, if you can imagine. Not the original William Shakespeare, but some descendant of William Shakespeare. And they got vaccinated today. So the UK is doing a very good job right now of rolling out the vaccine. And today is ground zero, day 1 for UK vaccinations. So that's extremely encouraging. And I do believe that the FDA is meeting this coming Thursday to probably approve the Pfizer vaccine. At least they're having the committee meeting, which means probably by Saturday you will start to see, well, you will see, I predict, an approval of the Pfizer COVID vaccine, which means that that vaccination program should probably start within the next 2 weeks. So obviously I'm going to recommend that if the CDC says healthcare providers and old folks get the vaccine, then we all need to be at the front of that line to protect our patients and other people that we're coming into contact with. But be that as it may, we've got, thank heavens at this point in time, preventative agents that are going to be FDA approved very quickly to prevent the coronavirus attack. But for those individuals who have had coronavirus, who are in the midst of getting coronavirus, who will get coronavirus before the nation as a whole can get its vaccination program in place, probably by the middle of next year, we need to know about the things that we can do to control some of the sequelae of COVID-19. So I've already mentioned getting your shingles vaccination if you're over age 50, because you certainly don't want to come out of a COVID attack and now have to deal with the shingles attack. And I want to remind you that as a neurologist, sometimes shingles is not an open and shut disorder. Many times people will develop long-term neuralgias from shingles, meaning they get the rash, they get the huge pain, usually over the eye or along the chest wall or down the leg. But then you can develop chronic pain for many, many months or even years after the shingles attack. And that's when you go and see the neurologist, and we have to give you medications, typically an anticonvulsant, an anti-seizure drug, to stop this electrical-like pain that can cause jolting in any part of the body that the shingles attacks. So it's extremely important that we get a shingles vaccine to prevent that as a long-haul sequelae, as a long-haul comorbidity of acute coronavirus infection. I mentioned about the high incidence of headaches associated with coronavirus. There is significant migraine-like disorders. Now, if you've had coronavirus and you're now feeling good and you're not having a temperature and you want to go back to work, but you're complaining of these vascular headaches, I think it's a very good idea to speak with a neurologist or your primary care doctor to find out what can be done about these types of headaches. We neurologists do a really good job of treating vascular headaches. We've got different types of treatments, both natural and prescription, that are available to manage headaches, everything from taking a magnesium or a Butterbur capsule all the way to monthly injections or an infusion. So we've got different types of classes of drugs that are very, very useful, very, very safe for management of headaches. So if you are suffering from vascular headaches, migraine-like attacks that are attributable to your recent coronavirus infection, again, speak with your primary doctor, make an appointment with a neurologist, because there is treatment available. You do not have to suffer with chronic migraine attacks. And the last thing you want to do is start to pop everyday Excedrin migraine or other over-the-counter compounded analgesics, because once you start that, then you're looking at a rebound headache disorder. So you started with a migraine disorder that the coronavirus gave you, and now you've given yourself a rebound headache disorder because of all the Excedrin that you're chugging, and it's not good for your liver anyway. So very important to recognize that headaches are one of the commonest long-haul sequelae of the coronavirus. And remember, the coronavirus enters your nervous system by way of the olfactory nerve, which is cranial nerve number 1, and then it can also enter by way of the oral pharynx, the oral mucosa, and that will affect your sense of taste, which would be cranial nerves 7 and 9. So at that point, we know it's a neurological attack, and therefore the sequelae are typically neurologic. Another issue that is very, very common that we neurologists are seeing vis-a-vis an acute coronavirus infection is this chronic brain fog. People will say, I'm not only tired from the corona infection, I not only have muscle fatigue and some residual achiness, but I'm just not thinking clearly. So obviously, we know that when you're not thinking clearly, that could indicate some type of brain disorder. And we've just said that coronavirus is a brain attack. So therefore, it's important to get to a neurologist if you're fearing that your cognition, your memory, your mental sharpness is off. And obviously, at that point, we neurologists will have a high index of suspicion that there is some type of cerebral disorder, brain disorder associated from the coronavirus, a long-haul sequelae. An examination will occur in the office, and then oftentimes we will send you for a brain MRI. Why? Because we know that there is a very small incidence of patients who actually can develop a stroke from coronavirus, and that has to do with a protein that's elaborated that causes the blood vessels in the brain, in an area of the brain, to shut down and stop perfusion, stop flow of blood to that area of the brain. So if you're experiencing any brain fog, any difficulty with attention or focus, at that point it would be a very good idea to speak with a neurologist to make sure that you haven't had a stroke. Now, I can tell you, most of the time it is not a stroke, it's just a brain fog. It's your brain is not functioning well, and it has nothing to do with pulmonary problems, it has nothing to do with metabolic problems, it's just the residual long-haul effects. In that setting, there's a lot that we neurologists can do therapeutically. There are different medications that we have in our little black bags that we can use to help improve attention, improve focus, improve level of wakefulness, alertness. All of those things we have available to us. Now, again, I want to tell you there's no drug that is FDA approved to cure or treat COVID virus. There's no drug per se that can cure the virus itself. We are using different types of techniques in the hospital, everything from steroids to monoclonal antibodies to different types of antibodies to vitamin D to see if that is something that will help the outcome in the hospital. And we know that these treatments probably may be helpful because those patients who receive those treatments tend to have a shorter duration. You've all heard about remdesivir, the Gilead product that's approved to shorten the hospitalization, but there's nothing per se that can actually cure the virus and deactivate it instantly. So for those of us who've been sick with COVID, we have to confront some of these long haul sequelae if we've been symptomatic. Now, as I've said, many folks have no symptoms associated with COVID. That's what makes it so dangerous, because it's so transmissible, and that's why it's important that everybody wear a mask and stand 6 feet apart. But the point is, cognitive clouding, brain fog can be a significant sequelae. It's treatable. See a neurologist if you're having those types of conditions or symptoms, because all of this stuff can be alleviated with various types of medications that we neurologists have available to us. I want to spend the last few minutes, I've talked a lot about the brain, but I want to remind you that sometimes the coronavirus effects can be very peripheral. A lot of folks will complain of neuralgias, they'll complain of tinnitus, ringing in the ears, they'll complain of vertigo, and that's not a central nervous system disorder, that's a peripheral nervous system disorder. So when we think about central nervous system disorders, we're thinking about brain fog, we're thinking about migraine. Very rarely, I have seen a few patients develop seizures, and again, those are all CNS conditions. But there are some peripheral symptoms that can persist, and again, very, very treatable. So if you have had nerve pain, neuralgias, tingling, muscle aches and pains that are persistent beyond a week or two after the resolution of the coronavirus infection. So if you're now at day 20 or you're at day 30 and you're having tingling of the fingers, tingling of the toes, muscle pains and aches, again, important to consult with your neurologist. Why? Because these are symptoms that are easily controlled. We know that the coronavirus can cause neuropathy. I've discussed this previously in other Facebook Lives. There are abundant reports in the literature where patients with coronavirus develop almost like a neuropathic pain, irritation of the nerves that control sensation in the fingers and the toes, almost similar to what we see in diabetes. And those types of symptoms are very controlled easily with a little bit of medication. And again, when I talk about medication, I'm not talking about lifelong medication. I'm talking about things that will be used for the duration of the symptoms, at which point we will slowly taper you off of that regimen to make sure that you've healed up on your own. But in the meantime, there is really no need for you to have to suffer with these long-haul sequelae. So recapping the lots of information that we've discussed today, coronavirus, first and foremost, is a neurological condition aside from a pulmonary condition. It hits cranial nerve 1, the olfactory nerve. It hits cranial nerve 7 and 9, the nerves that control taste along the front and back of the tongue. So it hits you on a neurologic basis, and then it can affect your brain by virtue of either brain fog, headaches, very rarely seizures. It can sometimes aggravate a latent Parkinson's disorder. Again, rare, but reported in the literature. And then on a peripheral basis, you can develop neuralgias, tingling, achiness of the extremities, and all of this can be very annoying. It can disrupt sleep, and it can cause difficulty with daytime activities, difficulty with working, difficulty with child rearing, and just an overall sense of being unwell and fatigue. So if you are experiencing these types of symptoms, it's very important that you seek treatment from a neurologist, because we've got lots of goodies in our little black bags. I wouldn't say goodies, I would say lots of treatments in our little black bag that can easily get rid of these symptoms and bring you back to feeling good and a state of health. And then, of course, we would try and taper those medicines in time, because at that point, the body has probably healed up to its own accord. So, recapping, shared a lot of information today. We think of coronavirus as a 10-day illness, and in many respects, that's the duration of the infection. However, many individuals, and we don't know who that is, We don't know how to genetically screen or find out who's going to be with side effects on a long haul basis and who's going to just be asymptomatic or asymptomatic after 10 days. But I can tell you that for those individuals who are symptomatic, there's lots of good treatment. We neurologists have the ability to treat that if it is a neurological symptomatology, if you've got those neuro symptoms. And we're eager to treat because these are things that can be very disabling and can be very much helped with existing medications that are out there. As I've said, unfortunately, there is no cure for coronavirus. Right now, what we've got available to us are the vaccines, which are probably going to be FDA approved within about a week and are going to be rolled out initially to health responders, healthcare workers, and then probably to nursing home people. Now, I want to remind you that the way the vaccine status is right now is you're going to need 2 shots, meaning you're going to have your first dose, which primes you, and then a second dose 2 weeks later, which is going to amplify the antibody immune response. So when they say we're going to have 40 million doses, well, guess what? That's only 20 million people because each person requires 2 doses. Now, you might say, well, 20 million people is a lot. I want to remind you, there's 50 million people over the age of 65, and you've got several million healthcare workers. So we are going to be looking at coronavirus as an endemic situation within our population well into 2021. So with that being said, mask up, hand wash, 6 feet back, maintain your good social distancing, keep yourself very carefully away from crowded indoor spaces, and then when the vaccine is available to your group, whoever you may be, so if you're 45 years of age and a computer tech worker, you're probably not going to see that vaccine till sometime in April or May. So at that point, you're going to have to do everything you can to maintain good public health precautions to keep yourself out of harm's way. If in the event that you do get the coronavirus, rest assured that the treatments are getting better. So the death rate is dropping by virtue of all the good medical technology that we've got available on a therapeutic basis in the hospitals. And then we neurologists can really do a great job of helping you alleviate some of the long-haul sequelae that do occur within a significant percentage of the coronavirus population. So I've shared a lot of good news. I'm available to you always via email, jgelblum@fcneurology.net. That's First Choice Neurology. And I look forward to taking any of your questions via email. And if there is a problem that is concerning you or a loved one regarding coronavirus, please feel free to make an appointment because we at First Choice Neurology are always eager to take care of you. And on that note, I'm going to wish you a very safe, corona-free, and optimistic afternoon. And I look forward to chatting with you again real soon. Thank you and have a great day. Bye-bye.